There's a secret some nursing homes don't want you to know. They often drug the elderly to sleep rather than hire enough staff to take care of them. They use powerful, potentially fatal drugs to do it. Drug them up so they'll shut up.
Correct.
There's even a term for it.
They say take this lady to China.
What does that mean?
This can be any medication that will put a person to sleep.
Drug them so they'll fall asleep.
So they can go to sleep.
So that they're easier to take care of?
Yes.
You are listening to an informant who works directly with nursing home residents. She says she's seen the drugging firsthand. We're hiding her identity because she fears retaliation. The families, they have no idea.
They have no idea.
We found far too many Texas nursing homes are drugging the elderly, and they're going to extreme measures to hide it.
Call from extension 9.
Let's start from the beginning. 7 months ago, I got a phone call.
Please help me. Please, I'm begging you to help me.
I'm really scared for my life. Please. They tried to drug me illegally today. I found it in my glasses.
The caller asked I come quickly.
It is 10 minutes to 3 p.m. I am at 301 South Houston Street, Kaufman, Texas, but it's called Kaufman Health Center.
Hours later, I go inside the Kaufman Healthcare Center and find my way to room 104. That's where I meet May Vall, the woman behind that desperate call. Hi, May. I'm Charlotte. When I entered, the smell of urine was undeniable. How are you? May is here because she's too weak to get herself out of bed, so she wears diapers, requiring someone to clean her regularly. See those flies? No one has come around lately.
So you've been lying in your pee and poop for how long today?
Today, all day.
But around here, she says, that's the norm.
I thought when I got older, man, I was going to be a grandma sitting on the porch. Everything was going to be wonderful. It's not. If you go into a nursing home, you're treated like a dog.
Fed up with her care, she started complaining. She called her family and even the state. When the nursing home caught wind of that, May says a strange new blue and white pill began showing up with her meals.
And I said, whoa, wait a minute. I said, what are these for? And she says, you're refusing to take these? I said, I don't know what they're for. Yeah, I'm going to refuse to take them.
She then suspected staff was hiding the drug in her lemonade. She gave it and the pills to me and asked I go find out what they are. We sent May's lemonade to a lab for testing. May was right. The drink contained an anticonvulsant with sedative effects, the same drug she had refused to take. The feds recently busted the drug's manufacturer for giving lucrative kickbacks to nursing homes that prescribed it to sedate residents, a use not approved by the FDA. A few days later, look at what May recorded.
When you see the little beads flying around, they're still trying to illegally drug me.
Days later, and still refusing to take the drug, the nursing home has May removed, citing increased agitation as the reason why. May's nursing home would not answer our questions, but did tell us each resident is treated individually and staff follows orders of the treating physicians. It's now September. May is in a new bed in a new nursing home. But once again, she's given a strange new pill. See that white one there? It's Risperdal, an antipsychotic.
I said, what is this for? And she says, for your schizophrenia. I said, schizophrenia? I says, all of a sudden I've got another diagnosis?
That's inappropriate. That's completely inappropriate.
Inappropriate and dangerous, says Dr. Daniel Pearson. He spent a decade as a psychiatrist in nursing homes before becoming head of psychiatry at Methodist Hospital and says antipsychotics come with serious risks. That's exactly why the feds say they should only be used if you have one of 3 mental illnesses, the most common being schizophrenia.
But if you're using it just to keep people quiet, that's putting them at risk of increased risk of cardiac death, increased risk of falling, breaking a hip.
About 6 years ago, the feds noticed taxpayers were spending more on antipsychotics in nursing homes than any other class of drugs. Nursing home staff was using them to make their jobs easier and sedate difficult but not psychotic residents.
Let me just say, sir, it's really a shame in this great country, as much money as we spend nursing home care.
I agree that it's a shame, and I agree that we need to do better.
Back then, Texas was among the worst offenders in the country. But since then, the state's nursing homes claim they've made great improvements. We found that may not be true. Many nursing homes have not stopped drugging residents like they may want you to believe. We found some have, however, figured out how to fly under the radar. How? Just justify the prescriptions by diagnosing residents with psychotic conditions.
Does it surprise me? Probably not. Are those diagnoses appropriate? Probably not.
Our analysis of nursing home data discovered since that crackdown in 2012, schizophrenia in Texas nursing homes has skyrocketed, increasing 26%. But typically, schizophrenia develops in your early 20s, not later in life.
What is the likelihood of somebody being diagnosed with schizophrenia at, say, the age of 70, 80 years old?
Almost none.
May was diagnosed with schizophrenia at the age of 68. The feds acknowledge our findings are unusual. The state had its own suspicions, too. Officials sent this 2016 memo to all nursing homes reminding them that intentional misdiagnoses are fraudulent and dangerous to residents. But the drugs are not the problem. The lack of staff is.
About 70% of a nursing home's expenses are staffing. So if they can cut back on staffing, they can directly increase their profitability.
Cut staff, save money, and drug unhappy residents to sleep.
Hey, May. How you doing?
We recently caught back up with May. She's now living here at home with family who didn't want her in a nursing home anymore. To all nursing homes and their staff, she had this final message.
Would you want to be drugged and knocked out? Would you want your mind destroyed? Would you want that done to you? I don't. I don't think you would either.
If you have family in a nursing home, we're here to help right now. You can go to our website and see which nursing homes are the worst offenders and what percentage of their residents are on antipsychotic drugs when they shouldn't be. But doctors say the number one thing you can do is find out what your family member is being prescribed and why. And if the nursing home won't answer your questions, call us. We'll see if they'll answer ours. Charlotte Huffman, Channel 8 News.